Hello guys, welcome to the third part of our video, which is our 2019 exam of the Krok1. And now let's start from the question number 51, right? So question number 51 is, a patient with inoperable lung cancer accompanied by unbearable pain was prescribed an analgesic, right? So what are the analgesics? That's we all know, like, what are the analgesics? These are the drugs which decrease pain, right? Okay. Against the background of analgesic therapy, the patient develops signs of intestinal obstruction. Okay. What analgesic could have caused this complication? Right. So it's a direct answer question, guys, because it's the only morphine which can cause this complication. One more thing, guys, which I would like to add about the morphine, that it will also cause the decreased respiration in children, right? So it will directly affect on the respiratory center of the children. So that's why we avoid giving this medicine or the morphine in the childhood, right? So let's move directly to our second question, right? And others, one more thing, guys, like other, like this is the most potent analgesics also, right? Morphine is the most potent analgesic itself. So that's why, because like the patient is having the cancer, so he must be having like, it's obvious that he must be having this unbearable pain, right, which he's mentioning out here. So we must give the morphine, and the side effect is of the morphine is of the morphine itself is the intestinal obstruction. And what the second is the decrease of the respiration, or it will inhibit the respiratory center in children, right? That's it for this question, guys. If you will see for the other options, all of these are the analgesics itself, but again, like, the thing is, this one is the most potent itself, so we must give the most potent, right, for the case of cancer itself, because it's like the patient must be having so much pain, right? So let's move to the another question, that is Kosakov syndrome. Oh, that's is very, like, this is seen very common in the alcoholics, right, which is mentioned out here, like it's developed in the chronic alcoholics who have a low vitamin diet. Decreased transketolase activity can be observed in this course of disease, right? That is why this the disease develop. And one more thing, guys, this is basically due to deficiency of vitamin B1, right? Because like, you have seen those patients who are the chronic alcoholics, they are not that much focused on their diet, right? So that's why they must be having this syndrome. And one more thing, like, they must be having some neurological deficit itself due to this disease, right? Neurological deficit, again, like this patient, they are trembling when they are not getting the alcohol, they must be trembling itself. So there are a lot of sign of this Wernicke-Korsakoff syndrome. Again, what vitamin deficiency is the case of this disease development? Itself, guys, like the Wernicke-Korsakoff syndrome is itself just due to only one vitamin, that is what, vitamin B1, right? And what is the name of vitamin B1? That is the answer, that is your thiamine, right? Again, like, let's just move towards the other options itself, right? So retinol, what is retinol, guys? This is vitamin A. And one more thing, guys, like the always remember, guys, A, D, E, K. So what are these, guys? What these are the fat soluble vitamins, right? So the fat soluble vitamins have the more, right? They have itself, like, like the, I would say, like, they have their storage, right? They have more storage inside the body, because this is the fat soluble vitamin, right? So they can live in the liver, right? Whereas the other vitamins such as vitamin B and C, right, this must, like, this must live in the, what part, guys? It must be in the, like, these are the water soluble vitamin, right? So we need them regularly, because this can be easily get excreted with the water itself, right? So this is, you should remember. So yeah, retinol is from the vitamin A, right? Retinol is vitamin A, right? And it's a fat soluble vitamin itself. So yeah, there is not that much need of the vitamin, right? Second is the cobalamin, which is this one, guys, like this is the vitamin B12. Again, guys, like, there are two vitamins in the B category itself, that is vitamin B9 and vitamin B12, right? Body store this for a long time. Vitamin B9 is what we just discussed it yesterday, it was folate, right? Vitamin B1 is what, cyanocobalamin, right? Or for the sake of this question, let me just write down cobalamin, okay? right? So the body is storing this kind of vitamins such as the folate. It's about the 3 to 4 months, and for the cyanocobalamin it's about 3 to 4 years, guys, right? So you just like remember this number, like not definitely this number, but you just know best about these things. That is it. So riboflavin and the niacin, we just discussed it about this, guys, yesterday also. What is it, guys? Niacin is vitamin B3, right? And riboflavin is itself vitamin B2. So we don't need these guys that much inside our body itself. So these are like this okay, like this their deficiency can itself cause a lot of disease, but like no, that it's simply given as the Wernicke Kosakov. Like just to tell you guys about about just to explain the option. That's why I'm saying a lot about this, but you must like get this point itself. So this can't be answered, this can't be. So the even after the elimination method you can just reach to this answer, that is thiamine, right? Next one. Regional lymph nodes surrounding an infected wound are enlarged, right? So that is what it said, right? So like sometimes when you go to the doctor say, okay, just show me your like tongue and everything, right? And sometimes they used to check behind your neck also. So what are these guys? So those guys are basically checking for your lymph nodes, right? And why are they checking for your lymph nodes, guys? Because see, if there is an infection, right, and what is the work of the lymph nodes itself? To trap the bacteria. And when they trap the bacteria, like they will invite a lot of macrophages and other guys, like those bodyguards of our body, right? So that's what happened in the question also. Okay, macrophages are there, lymphocytes and the lymphatic follicles are increased in the lymph nodes. So what must be the process which is going on out here? Like you can just think it in this way. So maybe there is some like foreign body which entered inside our body, right? Inside our body, let me just make something like this. Okay, so there may be some like lymph node out here which okay get some antigen stimulated from out here itself, right? So that must be the case, as well as large amount of plasma cells is seen. Okay, what process in the lymph node is indicated by these histological changes? Okay, then let's see. Okay, that is itself what? Antigen stimulation. Why not other option, guys? Neoplastic abbreviation, is it cancer? No. Transplant rejection, the patient, like there is no history given about the transplantation, so no, it's not possible. Acquired deficiency of the lymphoid tissue and the congenital deficiency of the lymphoid tissue, right? So there is not enough like I would say history about these things. And second thing is, if there is deficiency of the lymphoid tissue itself, so there must be like not this kind of process is happening. So this can't be the answer itself, right? So the only and only answer possible in this case also, it's the antigen stimulation. Okay, so human genetic apparatus, this is our question number 54. Human genetic apparatus consists of the approximately 30,000 genes, right? That's true. While the number of antibody variants can be as high as millions, right? What mechanism lead to the formation of new genes that ensure the synthesis of such number of antibodies, right? So what is it, guys? See, like let me just make a very superficial example for that. For example, this is a gene, okay, right? So let me just write out number 1 2 3 and 4 out here. So sometimes what happen is like the 1 can directly be connected to the 3 and 4, right? In the other case, what can be possible inside our body, right? So like the 1 can directly be connected to the 4 also sometime, right? Thereafter it can be connected with the 3. Just like think about in this example. Okay, so this is what, like this is the like the recombination, right? So the body is itself making what? Recombinants of itself, right? Recombinants. So that's why like we have a lot of antibodies inside our body itself, right? So this is only the reason, that is what? Genetic recombination. And that is our answer also. That's here, genetic recombination. DNA replication, no. If DNA is replicated, it must try to make like as same as DNA, so it's not possible. DNA repair, no. Of course, no. Formation of Okazaki fragments, why is it the answer? No, it's where the Okazaki fragments are seen, guys. It's in the what? So like just type out in the comment section of this video, is it in the, let me just give you a hint. So is it in the lagging strand or the leading strand, right? So one of these is the answer. just type out. Okay, gene amplification, no, we do it we do it like after pulling out in the laboratory for diagnosis of some diseases itself, or for seeing okay if a particular kind of gene is responsible for some diseases. That's why we use the gene amplification method. This can't also be the option itself, right? A patient was administered a certain drug to relieve cardiac rhythm disturbance. Okay, this drug can be local as anesthetic as well. This is easy now. Which is this drug, guys? Because this kind of description is only possible for our favorite drug. That is what? Lidocaine, right? And again, these are what? Lidocaine. Also, it is lidocaine, right? Again, other like all of these are the having what the uh, analgesics effect, right? Like yeah, these are what anesthetics. Sorry, anesthetics. But none of this is having any effect on the heart. So like yeah, this only lidocaine which is having the effect on the heart itself, right? Let's move to the another question. That is what chronic overdose of glucocorticoids leads to a development of the hyperglycemia, right? That is true because that's the work of the glucocorticoids also. What is like what glucocorticoids am I talking about? Such as let me just say adrenaline, right? So adrenaline is itself having work to increase the sugar inside our body, right? And how the sugar is increased immediately, that is by the process of gluconeogenesis, right? So in other words, I can say that okay, the adrenaline is stimulating the gluconeogenesis, which is increasing the sugar itself, right? And what name the process of carbohydrate metabolism that result in elevated blood glucose level, right? That is right here, right? So that is what gluconeogenesis. Again, let's see the other options itself. Anaerobic glycolysis, no, like there is enough supply of the oxygen, so this can't be the answer in anyhow, like in any condition this can't be the answer, right? Glycogenolysis, so glycogen like breakdown, well that's of course happening with this process, but like it's not for the that much, right? Like if you just think about it, if you will read about the work of the adrenaline itself, right? You will itself see okay, it will increasing the gluconeogenesis, right? So it's itself by the breaking of the glycogen, but it's not itself the correct answer. Pentose phosphate pathway, it's important for the DNA synthesis and NADPH production. So none of this is the reason out here. Again, the last one is the glycogenesis. So this can't be the option because in this process, glycogen is if the glycogen is getting produced of, so there must be a like high amount of sugar which is directly converting in the glycogen. So yeah, this must be happening out, but this is not the reason for the like increasement of the blood sugar inside the blood increased glucose, right? So this should not be the reason. So the only reason which is possible out here, that is the gluconeogenesis. Okay guys, another question, that is ingestion of the plants and mushroom that grows along the highways is dangerous due to risk of the lead poisoning, right? And where is the lead come from inside like this mushroom? That must be from right, lead is the one of the most, I would say, the like the toxic element itself. So we should not eat the lead itself because it's what is it, toxic, right? And see what happens out here, like because there are a lot of industries which are growing, like we lived in the industrialized world nowadays. So what happens out there is, so there is a lot of pollution, right? There's a lot of pollution, and what happens sometimes is like the lead, these are the okay, lead is sometimes consumed by some plants, right? Plants which grows alongside the highways and those things, right? So that's why we should not eat these things, because like even you have heard from your maybe grandfather or your father, like you should never eat those mushrooms which are which grows alongside the highways or alongside the fields, right? So that is the reason itself. So what is the main source of the environmental pollution in which this chemical element, that is exhaust fumes, from where, from the industries itself, right? So again, acid rains, this doesn't happen every day, right? Acid rains, no, it's not possible. Chemical fertilizers, well, we use that, but like that, these are not containing a lead. Sewage, well, it's not alongside the sewage, so this can't be the answer. Herbicides, yes, this can't be the answer itself, because this is not even related to this topic itself, right? So the only answer possible, that is the exhaust fumes. Surgeon noticed segregated lymph nodes PR patches, right? This is a direct answer. Where are the PR patches located? That's in the ileum, right? That's easy, right? That is ileum. Next question. Young woman of foreign state, Tehran. Where is Tehran, guys? This is the capital of Iran. Iran's capital is what? Tehran, right? Heaviness in her lower abdomen and a small amount of blood being excreted with the urine at the end of each urination. Okay, so there may be some problem where inside her, let's say the bladder. Okay, so and bladder is a part of the urinary tract, right? Let's now move further. Microscopy of urine detects presence of parasite, so there must be present of some parasite out there. And like it's the size is also given out there, it's about the 140 to 870 micron size. Okay, well, we will not remember that, so let's just okay, remove this thing out here from this. And like, what is the main thing here? That is what? Terminal spike. And the terminal spike is only present in the schistosomiasis, right? And let's see the other options also that is what? Opisteriasis, that is present in the uncooked fish, right? So you will also get a question, maybe like if you are doing some other year question, so there is a question present like this. So if the patient has ingested some raw fish, what is that case? Okay, that is the fish. And the next one, that is the paragonist meiosis. Like they have never asked this question itself, but I like just for the sake of explanation of this option itself, I like the paragoniosis is just due to the what? Undercooked crab or the crayfish, right? Schistosomiasis itself, but what are these specifically? Platforms with the terminal spike. This is the distinguishing feature. Again, Glycogenolysis, these are present in the snails. Fasciolithiasis, this is from the beef, sheep or cattle. These are transmitted in that way. And again, guys, like the other all infection, right? Except from this one guy, these are from the these are mostly related to the GI tract, right? So just remember this thing also. This can also be a I would say the better thing to remember itself. You will think, okay, these are the infection of GI. Okay, this is infection of GI. This is infection. This is infection of GI. This is infection of GI. So like by excluding method itself, you can just go to this option, schistosomiasis, right? Let's move to the other question. In an experimental laboratory, rat was subjected to a stress factor, that is what? Electric current in this case, okay, which resulted in muscular hypotonia, right? Arterial hypotension, okay, so everything is getting decreased nowadays now in this. Hypothermia, oh my god, and hypoglycemia in the animal, right? So what period of the general adaptation syndrome is it? So okay, like I just mentioned the general adaptation syndromes phases, that is what? First of all, it's the alarm stage, the other one is the resistance stage, and the third one is the exhaustion stage, right? So what happen out here? If you will see in the alarm stage, like it is the phase of the flight or fight, right? Such that the corticosteroid like this kind of hormones are released from the body, so the patient will try to adapt from this stress factor itself, right? But there is not the case, everything is getting decreased off, right? So this can't be the answer. And that is the what? Resistance stage. Body returns many physiological function to normal level, and the blood glucose level must be high, but in our case it's low, right? It's given like the hypoglycemia is present out here, right? So this can't also be the case. Okay, what is the last one? That is the exhaustion stage. Stressor continues beyond body's capacity, body exhausts resources and becomes susceptible to disease and mortality. So finally what will happen? Like the patient will die either, or it was on the just it's the termination of the resistance stage. That's the exhaust. Okay, now you can do anything, like I'm just exhausted, right? But what is happening out here, like if see the everything is decreasing out right here. So first of all we should like okay, we should terminate all these options out here, right? It's itself not an anti-shock phase. Why should it be an anti-shock phase? Because uh, uh, see, in an anti-shock phase these things must be elevated, right? The blood glucose and everything, like the adrenaline itself must work in that way, right? It must compress the vessel and it must increase the tension, or it must increase the blood pressure that way, right? So it itself makes sense, right? So what is left? It is our shock phase. Why the shock phase only? Because see, in the shock phase what will happen, like all these symptoms, right? That's the hypothermia, muscular hypotonia, hypotension, hypoglycemia happens in this case only, right? So that's why the answer is shock phase. Got it? Okay, so what the is the next question? That is our human brain produce endogenous peptides, right, from in itself, and similar to the morphine, that is what endorphin, right? That is a direct question from the physiology. Next question. Okay, this is a very important question, guys. The man is a carrier of HIV, that is a RNA virus. This cell is the of this patient synthesize viral DNA. With what is this process based upon? Okay, so that is itself what reverse transcription, guys. So like this is our process normally, right? And okay, sorry, first of all we have what? DNA is converted to the RNA, and RNA gets converted to the proteins, right? That's a simple pathway. Okay, so what is this process known as from DNA to RNA? That is what? Your transcription, right? But what will happen if RNA dependent DNA polymerase will get activated? That is known as what? Reverse transcription, right? So this is happening in the HIV also. So the question itself is giving you a lot of clues to just get to this answer. HIV is an RNA virus. Well, we all know that the patient synthesizes viral DNA. So RNA to DNA can only be possible with the process of reverse transcription, and that is our answer. Other question, see the other options except these two, it doesn't even like I would say okay, let's check this one also. But other the repair itself, no, it doesn't mean anything out here. Replication is what? DNA to DNA, right? So this can't also be the answer. Transcription and translation. So transcription is from DNA to RNA. So the patient, so in the question it's saying about RNA to DNA. So this can't be the option. Again, translation is what? RNA to the proteins, but this can't be the answer also itself, right? The only answer which is possible here, that is the reverse transcription, right? The old man whom for a long time has been drinking alcohol in the large amounts, okay, and died at home, is being conducted. Macroscopically, the right lung is tense and enlarged. Okay, so like let me just draw it like this. Okay, so this can be the okay, the right lung is the dense. Okay, let it be, and enlarged. Its tissue is gray and homogeneous on the section. So the gray color tissue is present, right? Its pleura is covered with the glace membrane deposit, and the microscopically what happens is the alveolar cavities contain the fibrin threads. So the guys, and the neutrophils. So the neutrophils are present, right? I can think about an infection out here, right? And what infection is the most common in the site of lungs? It will guess what? Pneumonia. And again, guys, like the another clue which I got for the pneumonia, that is what? Your grayish membranes. It's out here, like the grayish membrane deposits which is out here. Neutrophils is also present in the hemolyzed erythrocytes. Well, that is the work of the Streptococcus pneumonia, or like the pneumococcus. That is the better word, I would say, the pneumococcus, right? Well, okay. So make the diagnosis. Of course, that is what? Corpus pneumonia. Nothing else. Let's see the other option also a little bit. So the another one is the focal pneumonia. No, it can't be the present because it's not located on a particular focus. Okay, so it's not located, for example, right here or right here, right? So this can't be the answer. Next, simulated pneumonia. This can't also be the answer. Otherwise, it should be something like this, right? Third one is itself is primary pulmonary tuberculosis. No, there is nothing like tuberculosis because see, I don't have any history of the tuberculosis, right? Thereafter, last is caseous pneumonia. See, guys, caseous pneumonia is mostly seen in what? Tuberculosis, right? It's mostly seen in the tuberculosis. So there is no itself the history of tuberculosis. So this option can't be possible also, right? So the only option possible, that is what? Corpus pneumonia, and that is our correct answer. Next question, that is what? A patient for a long time on the imbalanced diet on the proteins. Okay, so the patient is not eating enough protein, and we all know what will happen next, right? Because we already did some questions on the last videos, I remember. That is what? Your edema is going to happen. Okay, now I know this point, which resulted in the hepatic fatty infiltration. Okay, so we have a different little bit twist in this question. This condition likely to develop in a certain substance absent in the person's diet. Okay, so now see, the patient is having diet, right? The patient is having diet but is imbalanced, right? I have an important question out here. If it's maybe an imbalanced diet, it must be low in proteins, right? Which is given right here itself, right? And which substance is absent in the patient's diet? Then this substance, let's see the options, and let's just like use the elimination method itself, right? Okay, the over options are alanine, cholesterol, acetic acid, biotin, and methionine. See, guys, alanine itself, like it's more towards like the synthesis or the, like I would say, the transportation of NH2, or the the ammonia transportation. So this can't be the answer. If the patient is already having a lot of cholesterol, for example, he must not be having this edema or something, because cholesterol metabolism is totally different from our protein metabolism, right? Biotin is what? Vitamin B7. And vitamin B7 may have like a lot of problems itself, because like a lot of the reaction in our body having the cofactor of vitamin B7, right? But still, like if the patient is still just only and only having the edema, so this can't be the answer itself, right? Okay, last is acetic acid. Acetic acid is not even like usually present inside the body, right? So this can't be the answer itself, because like acetic acid is mostly seen in what cases, guys? You will just comment down. Okay, so where we see the acetic acid. And last one is the methionine. Why methionine, guys, is the answer? Because methionine is simply essential for the synthesis of proteins inside our body itself, right? So that can be a possible answer out here. But other also, you see, no, these are not even related to the question also. So see, no, it's getting so much easy for you guys, right? And still, if you're having any confusion in these questions, you can directly contact me out in the Insta or Telegram or email, right? Not a problem, anytime. Okay, let's move to the next question. 52-year-old woman come to the neurologist, okay, with the complaints of loss of skin sensitivity on the right half of her face. Okay, so for example, this is a woman, and she's having like the decreased skin sensitivity on her what right half of her face. So okay, let me just make it something like this. So this area is what? Affected area. Okay, so affected area, okay, of her face. Now what else we have? Lower eyelid, for example, right here. Nasal arc out here. Okay, for example, let me just make it out here. And upper lip, so it's out here, right? What nerve is damaged in this patient? Okay, so let me just make a a superficial diagram of what she's seeing. So this area, okay, let me just make it okay, so this area of this woman is having problem, right? So this is what I got in the history. And from the anatomy itself, I know that So what are the nerves innervating out here? Okay, so like v3. Okay, like we have the v1, v2, v3, right? v1 is innervating in about this part of the head. Okay, of about the this part. v2 is innervating in the this part, and v3 is innervating about in the this part, right? And the patient is having the problem in this part, so I can just get a superficial idea about it. Okay, now let's see the options itself. Ophthalmic branch of the trigeminal nerve, no, it must be about this area or maybe something near to this, but it's not possible here. Greater petrosal nerve branching from the facial nerve, so it's v7, right? So v7 is itself a motor nerve, right, for the most of the cases, and it's not the answer. Coda tympani branching from the facial nerve, no, it must be innervating what? Tongue, or near to the tongue, right? Mandibular branch of the trigeminal nerve, why should it be the answer? The area here we have no history, like it's the perfectly fine according to the woman, but it's not given out here. But we must think, okay, only this area is what? This area is the effective area, right? Okay, this area is the effective area, right? Okay, I just made a lot of mess out here, sorry for that. And let me just clean it up. Right, so that's why we have our answer, that is what? Our maxillary branch of the trigeminal nerve. Okay, so this is our answer. A woman with the allergic neurodermatitis was prescribed the second generation antihistamine without depressing effect on the CNS. Let's see, guys, there is only one H2 agonist or two H2 agonist which I should prescribe out here. That is the but like the diazolin and the loratadine. But see, the only loratadine is not having any kind of CNS effects itself. So, right, you should know about this. This is a direct question itself. Mother's karyotype was 45. Okay, we know. And I determined to the translocation of 21 to 14. Okay, so 21 to 14 dislocation is happened here, right? So now what is the it's the child of this woman. If the father's karyotype is normal, so father is having the XY, right? Mother is having what? Okay, right. So again, the woman is also having a normal karyotype we have here. So, and like what she's saying is like, okay, so there is missing of what? 21 1. Okay, 21's chromosome. So what should be the answer, guys? Edward syndrome, it's the trisomy 18. Well, this is written wrong here. That is must be Patau syndrome, right? 13. Klinefelter, about it's what? Klinefelter is your XXY itself. Murray syndrome, it's androgen insensitivity. It's itself a X-linked recessive trait. It's not something like this mutation. And finally we left with the Down syndrome itself, right? And again, the Down syndrome is having what? 21 syndrome, 21, it's the dislocation of 21 chromosome itself, that is it. So okay, 21, that is it. 21 is having the pathology, that is your Down syndrome, right? And here I will just want to add one more, that is what, if I can add, that is your we have Klinefelter, we have Patau Edwards, we don't have Turner syndrome, guys. Okay, for the Turner syndromes we have the karyotype XO. Okay, so for the Turner syndrome we will see a female who is not particularly developed, and she's having like the shield chest, and she has not developed a lot of female features. She's having staked ovaries, right? She's not fertile and things like that. Okay, a man has been working for a long time in oil processing. We can directly think about the polycyclic amines, that is it. For the other thing, guys, don't even do much about it, because there are no question asked on this topic itself. So amino azo compounds, if I will say, okay, so what are the compounds which are directly linked to the amine? So it can also be what your say dye industry can be possible, right? Again, the nitrosamines we can directly see in the dye industry. Biological carcinogens, what are these? No, it can't be, because we have the history of oil processing, right? And the firstly is last is the amines. What kind of amines? It's not even specific, right? But for the oil industry, we have the specific polycyclic aromatic hydrocarbons. Last one, oh no, sorry, the last one we are on the 69. During the regular examination of school children are scraped from the perianal fold of the 10-year-old girl a symmetrical oval egg with the larva inside. So it must be what inside the vagina. And see, like the if as I wrote here, like this one, encyclostomiasis. It's a hookworm. It's mostly present in the GI tract itself, right? So again, of these are related to the GI tract, except this one, right? So this should be the answer. Enterobiasis. Clinical course of urolithiasis was complicated with the passage of renal calculus. Okay, so there must be some stone, right, which is disturbing the passage of urine. So let me just make a little bit diagram for that. Okay, this must be okay coming from other side itself, right? So this is just a rough diagram which I want to say. Complicated by the passage of renal calculus, wherein the ureter, okay, so this part here we know like this ureter is most likely to the stop. And see guys, like this must be the like it must stop out right here. Okay, so why it can be the answer? Because see, at the last part we have the anatomical narrowing, right, of the ureter. So that's the where it's most likely to stuck out here, right? So at the border between abdominal and the pelvic segments, right? So this segment about say, okay, that is it. Histone protein synthesis, which is what like H1, H2A, H2B, H3 and H4, right? So these are our histone proteins. So it's blocked in a cell where the cell structure nuclear is damaged as a result. So this, guys, like what is the work of these proteins? It's as I taught in my classes, the work of the histone proteins is to bind the DNA. Like you must hear those beard on the string structures, right? So the H1, right? So H1 is the only non-circular protein out there, but others all are the circular. Okay, let me just make about 4 proteins. Just think it in a 3D way. And this is DNA, for example. So I just, okay, it's about 1 3 upon 4. You can say 2 rotations, right? Near to the 2 rotations happening on the this structure itself. Okay, and the H1 is holding them. So where is the DNA present, guys? It's itself in the nucleus, right? Okay, now let's see the structures. Okay, it's inside the nuclear membrane, but it's not the specific one. Golgi apparatus not possible. Sample membrane, okay, let it be. But it's not even specific again. Nucleolus, okay, not specific again. What is the specific nuclear chromatin, right? So this is the specific part where we can say, okay, the chromosomes, okay, like the chromosomes are lying in the nuclear chromatin. And what are chromosomes? These are the totally condensed way of condensed formation of the DNA, right? So that is nuclear chromatin, right? After a prolonged attack of the severe headache, patient lost mobility on the left arm and leg. Okay, muscle tone is decreased in the affected limbs. Okay, so it's something like this. Right, so here in the left arm and leg. So okay, we can think in this way on this side, right? So this is the affected side of the patient, right? Okay, the muscle are spasmed. Spinal tendon reflexes are acutely intensified. Reflex zones are increased. What nervous system disorder can be observed in this patient? What can be possible, guys? See, let's see the option itself. Peripheral paralysis, flaccid paralysis, central, extrapyramidal, or the reflex paralysis. From the question itself, see if the it's given as the history of headache. So what can be the possible out here? That is what stroke, right? Stroke can be a possible complication which just happened out here and which caused the the decreased mobility in the left side, right? So that's why maybe this side of brain is not working, right? So maybe this side of the body is not having enough, right, enough, I would say, the muscle tone, right, or the movement. So that can be possible. So that itself what a part of central nervous system or the brain. So that must be central paralysis. And other kind of paralysis is having itself a, I would say, different properties, right? For example, in the reflex paralysis, there is no reflex present, right? Extra pyramidal paralysis, okay, so it's outside the pyramid. So now we have the dissection of the tracks. We are having, some motor function may be present, some sensory function may be absent out there, right? May be possible in that cases. So peripheral paralysis, maybe there is only nerve damage out here, but no, there is all about the whole body, right? So it's the hemiplegia the patient the it is talking about. Flaccid paralysis, no, again it can't be the answer. Well, so that is it, right? The only central paralysis can be the answer out there. People who remained in the hypodynamic stage, which is what, not in the active stage or in the rest stage. In the rest stage, develops intense pain in the muscle after physical exertion. What is the most likely case of this pain? See, guys, if you are not working for a long time, right, what can happen to your muscle? Maybe, the hype, for example, somebody is doing gym, his muscles are hypertrophied, and now the what happened actually, why the hypertrophy happened, what is the mechanism behind the hypertrophy? That's the, like, due to the stress, our muscles adapt. And if the adaptation of muscle costs with, like, it comes with the, big mitochondria, like the large number of mitochondria itself. But just think in an opposite way. What will happen if the patient is not in an active stage? The number of mitochondria gets decreased, the size of the mitochondria and the muscle also get decreased. So when he started working out, there is a lot of production of the lactic acid in the muscles. When there is a lot of production of the lactic acid in the muscle itself, guys, see, now the oxygen carrying capacity itself, because like the body is not now having that, I would say the body is not having that condition. So like it doesn't need that much movement of oxygen inside those muscles in and out. So if it's a new stress for the body, so body must take time for for the adaptation. In the meantime, what is happening, right? The enough oxygen is not getting transported to that muscle, right? There is not enough oxygen transporting to the muscle. So what is happening there? So anaerobic glycolysis is happening, right? For the anaerobic glycolysis, what is the final product we are having? That is the lactic acid, right? That's none of our like rocket science itself. So this must be happening out in this question which it's given out here, right? So let's see what is the, okay, it's the accumulation of lactic acid in the muscle. That is it. Easy. Intensive breakdown of muscle proteins, no, it's not happening that much fast. Increased content of ADP in muscle, it will not create pain itself. Decreased content of lipids in muscle, well, there are no lipid in muscles, well, it's itself a wrong option itself, right? Accumulation of creatine in muscles, well, no, creatine itself is what, a transporter of fats, right? So it can't be this, this option itself, right? So this is completely wrong. Next question. A family of two children. The younger child is under a year. The child has developed spasmodic cough attacks, right? Okay, so same clinical presentation was observed in an elder preschool in a month ago. Suspected petrosis infection, right? And what is the whole full name of the petrosis, if somebody can tell in the comment? Okay, that is your, okay, let me just help you. That is the Bordetella, right? Bordetella petrosis. What method enable the retrospective diagnosis of this disease? That is none other than your serological. This is a direct question, guys. There is no explanation for this method itself, right? Next question. 40-year-old woman on examination present with the intensified basal metabolic rate. So the metabolic rate is totally what? No, the metabolic rate is determined by what hormone, guys? That is your thyroid hormone, right? Now let's move further. What hormone present in the excess lead to the such condition? It's easy. That's your thyroid, right? Glucagon, it will lead to the breakdown of glycogen and all this, like it will increase simply the glucose level in the blood, but like there is nothing related with the with the basal metabolic rate. Somatostatin itself, it's what, like the it's the insulin like growth factor peptide, right? So it can't be the answer also. Aldosterone, no, it's a category of steroid hormone, but it's not leading to that much thing. Thyrocalcitonin, there must be some disturbance with the calcium metabolism, but there is nothing given like that. So the answer can only be what? Trazothirotin. 59-year-old man, a business manager, developed intense burning retrosternal pain that radiates to the left arm. The pain occurred in the evening after the tax audit. So here is a stressor, guys. What is stressor? That is the tax audit. So just think in this. For example, if there is a very rich man, or I will say the business manager, he's having this kind of meetings out there. For example, a tax. Okay, so now he's having some stress out there, right? And what will happen in our body when the stress is on? There is the stress hormones release out, right? What are stress hormones? That's your adrenaline. And what will adrenaline do? It will increase the blood pressure. How will it increase the blood pressure? We need to know that is by the contraction of the vessels, right? Contraction of vessels, for example. Okay. And what category of hormone adrenaline is, which we discussed just above, that is what catecholamines, right? 15 minutes later, the patient condition normalized because now there is no stress. What mechanism of angina pectoris development is leading case of this patient? That is the increased level of blood catecholamines, right? Now maybe you just get the answer. And let's see the other options also. The coronary atherosclerosis, it's happening out there, but it's not atherosclerosis. Okay, like that is the basic thing. Maybe there is in artery, right? There is some kind of clot is forming, but still it's not that much out here so that it can block the total artery, right? So this can't be the perfect answer out here. Functional cardiac overload, no, there is nothing like this because the patient is not having any kind of physical stress out there, right? So the cardiac overload itself can't be a possible option. Coronary artery thrombosis, if in that case, maybe the patient should not even like get normalized after this 15 minutes, so this can't also be the possible answer. Intravascular aggregation of blood cells, again this can't be the possible because this condition will be about similar to the thrombosis condition, and this is not happened, so this can't be the possible. So the only explanation which we have because of increased adrenaline, and adrenaline is a catecholamine, right? So that's why this can be a possible answer, right? Okay, let's move to the another question. That is what the neurological department received a patient but is complaining. He's complaining of the memory deterioration and the loss of mental work capacity that developed after a head trauma. Okay, recommend him a medicine for the improvement in the cerebral metabolism. So we need to prescribe what, guys? Nootropics, right? Right. And what is the best nootropics? That is your piracetam, which is given right here. Caffeine is also a stimulant of the mood and the cerebral stimulant also, but this is the best one. This is the best. That's it, right? Analgin, now we will give it in the angina. If we see this other option, and these two options are not even the near of what we are looking for, right? The patient with the leukemia prescribed 5-fluorouracil. What will it inhibit, guys? So this is the answer: thiamidylate synthase. And what is the use of the thiamidylate synthase? It is used for the production of thiamine, right? Thiamine. And thiamine is only present in the DNA. So if we will inhibit the synthesis of the thiamine itself, it will inhibit the production of DNA. So direct question, guys, not a big point, right? 63-year-old man who has been suffering from COPD, emphysema for 15 years, died of the progressive heart disease. Autopsy shows what? Nutmeg liver cirrhosis, cyanotic induration of the kidneys and spleen, ascites, and the edemas of the lower limb. So guys, this itself, this history is enough to declare some patient as what? CHF, right? Let's see. Okay, what type of heart failure can be characterized by such changes in the internal organs? That is it. We have our answer, right? In the right ventricular failure, guys, so there can be some pulmonary edema or things like that can be present, but all of this, if you will just think about this thing, right? Think about this question, the only CHF can be the answer. So the only thing, it may be possible that you may think, okay, there may be a separate segment, or why the whole heart? Just see the question itself, right? So he's already having the pulmonary segment, right? So by the pulmonary thing, I can just think about the left heart, maybe the effective one, right? And the autopsy is also showing the nutmeg liver, cyanotic induration of kidney and spleen, and ascites, edemas on the lower limbs itself. So it can also be, directly to the right heart also. So it can be, so it's what? Whole heart, right? So it's a whole heart failure from the 15 years itself, let's say. Not from the 15 years, or maybe, just say for minimum about 10 years, right? So it's itself what a chronic situation. And we have the perfect answer out here, which we are looking for. That is a chronic heart failure, right? Next question. Autopsy revealed a large wedge-shaped patch of a dense dark red tissue with the clear margins in the upper trombe of a right lung. So there is something like this, okay, right, something like this. And she's having some kind of, the patient is having some kind of a red patch out here. So what red thing can be present out here? Let's just see. Histological examination developed that there is necrosis of alveolar walls, okay, maybe possible. The alveolar lumen is tightly packed with the erythrocyte, so that is creating the red color itself, right? What process occurred in the lungs? That is the what? So maybe there is, what happened, maybe like there can be some hemorrhage, right? So that's why there are red blood cells out there, right? And maybe due to those hemorrhage there can be, like the death of this tissue, right? So that can be possible, and that is known as what? Hemorrhagic infarction. If there is gangrene, it must be having some dark, or it must be black color or gray color, right? Hemorrhage, so there must be blood flowing out from out there, right? So it can't be also be the answer. Finally, the atelectasis and the Karne's degeneration can also be answered, because these are not even related to the topics what we are talking about, right? So this is not even related. Next question. Just a direct question, guys. Institute recommends older people to take vitamin complex that contain vitamin E. What is the basic role of vitamin, guys? It's the antioxidant, right? Antioxidant. Whenever we talk about the anti-hemorrhagic, we can talk about vitamin K and sometimes vitamin C. Antidermatitic, well, it's mean anti-inflammatory. And what can be the anti-inflammatory? Let me just say, okay, vitamin C complexes, vitamin B and C complexes, right? Antinucleate, well, it itself is not nothing. Antiscobratic, no, this is the scabies, is something scabies, or we can just think about, okay, vitamin C out here. But like the vitamin E is only having the work as an antioxidant, right? Next question, that is your 40-year-old man is impaired venous patency in the lower limbs developed edemas. Okay, so due to the venous problem now, maybe, okay, this is a vein, right? So the patient is having the edemas. What mechanism plays the main role in the development of the disturbance? So like, yeah, I just discussed it, right? So there is venous problem, so there is more leakage out here, right? That is what it is. So what is happening out here? That is what simply the elevated filtration pressure. So there is more of the blood is getting filtered out here, and that's why it's the elevated filtration pressure out here, right? Hyperproteinemia, there is nothing about the kidney disease out here. Decreased gradient of the or the liver disease also, right? That needs to be mentioned itself, right? Decreased gradient of the osmotic pressure between blood and tissue. No, it can't be possible, because why should there must be like a decreased gradient of the osmotic pressure? Well, it itself doesn't make any sense. Positive fluid balance, well, that is what edema is, but still there is no mechanism of development in this option. Disturbed humoral regulation of the water mineral balance, so there is no complication of ADH or the vasopressin, I would say. So that's why it can't be the answer out here. Next question. So this question I think is really practical question itself. Why? Just see the question. A married couple come for the genetic counseling. The husband suffers from the insulin dependent diabetes mellitus while the wife is healthy. What is the probability of the child getting developing insulin resistant independent diabetes mellitus? See guys, this is even I would say a very practical question. Why? Because see, like this must happen in your family also. For example, somebody's grandfather is having the diabetes, right? Let me just say diabetes mellitus. So their chances, or like the child's chances of getting the diabetes mellitus is just simply getting increased, right? So they have the increased chance of getting this diabetes mellitus itself. So let's just see the option itself just by our this is common sense, right? This is a common knowledge itself. So what is the answer? That is the higher than throughout the population, because see, the insulin itself is not like transmitted as autosomal recessive, autosomal dominant, right? We've never seen this thing itself, but we know, okay, if the father or mother is suffering, so there is slightly more chance of the children they are suffering from the diabetes, right? So yeah, that is why it's the higher than throughout the population, right? Easy. Next question. Woman is having the attack of the cardiac fibrillation. She suffered from the stage 2 essential hypertension. What is the drug of choice to stopping for the attack? That is the again anaprylin. What is anaprylin, guys? That's the propranolol. And what is propranolol? That is the beta blocker, right? And this is again the drug of choice for the cardiac fibrillation. And again she's again having the hypertension. So well, we must think about it. And the anaprylin or the propranolol, it's the selective, right? That is the important thing to mention. That is what selective. Again, guys, the lidocaine. What is that? That is the anesthetic, right? So anesthetic, while it is having a slight effect on the heart itself, but it's the preventing the tachycardia, right? So it's just simply preventing the I would say no, just the tachycardia itself. But the drug of choice out here, that is itself what selective beta blocker, that is anaprylin, right? Again, the other drug choices, let's see, stack forwarded as nitroglycerin. We see more nitroglycerin invert in the angina condition, right? Potassium chloride, no, we see this more in what cases, guys? Potassium chloride, that is what? And there is more magnesium or the more calcium is present out here, okay? So just to decrease the force and contractibility of the cell, right? The strophanthin K, it's also from the cardiotonic drug, but they still not used with this drug because simply the drug of choice is anaprylin. That's the propranolol. That is it. There is no perfect there is not even like a perfect use of strophanthin K, but yeah, we use that, but not in this condition, right? 63-year-old man with a esophageal carcinoma present in the metastasis. Okay, so somebody is having, let me just draw a little bit of esophagus out here. Okay, and guys, one just a general question: what is the length of the esophagus? You guys know that is about 25 centimeter, right? Now let's move to the next part. Esophageal carcinoma he's having, for example. Okay, let me draw it out here. In the mediastinal lymph nodes, the cancerous cachexia. So okay, what pathogenic stage of neoplastic process is observed in this patient? So the disease is progressing itself, right? So that's why the stage is different. Is simply what progression. Transformation, no, it's not getting transformed from one kind to the other kind, right? So there is nothing like that. It was a cancer, it will be a cancer after this metastasis also. So there is no transformation, no initiation. Why initiation? Because it is already there, right? So there is no initiation of some cancerous process itself. So it's already the cancer. Promotion, they are not getting promoted itself. So yeah, the only thing left, that is the progression. Autopsy of a man who has been suffering from the mitral stenosis has what reveals dense brown lungs, right? And why there is dense brown lungs is present, maybe because see what happen is when you are having, for example, the mitral stenosis, right? So let me just try it out a little bit for you guys. For example, just take example. Okay, think this is a heart, right? And here is the mitral valve. And if the mitral valve is not able to function properly, right? So the blood is accumulating in where? In the lungs, for example. Okay. Okay, so this is lungs. This is lungs, for example. I think I can do it a little bit better. Okay, right, it's perfect. And the blood gets accumulated in the lungs. Okay, like this, for example, there's blood out there, right? And if there is a lot of blood, there can be like destruction of RBCs, right? Destruction of the RBCs will make a pigment which is known as what? Hemosiderin. And the hemosiderin is what? Brown in color. That is it, guys. That is it. That's why we have the answer of hemosiderinosis, right? We don't have any melanocytes out there. We don't have any the in the hemochromatosis we have the more of the color, I would say golden color, right? So we are not having the golden color out here. We're not having jaundice. Well, not the jaundice. Why the jaundice? Jaundice is mostly related to the destruction of RBCs intravascular, or there is some defect with the liver itself, right? No. Lipofuscin, well, it's a physiological pigment, right? It's a physiological pigment which is made by the peroxidation of lipids, right? So it's more related to that lipids. Well, it's not the answer again. So the only perfect answer out here, that is the hemosiderinosis, right? Next question, that is, a patient with severe poisoning was put into the intensive care unit. In the course of the complex treatment of the subclavian vein needs to be catheterized for the medicine administration, right? So the vein is located in the following topographical structure. The answer is spacium antisclenum. Well, a lot of students are having confusion in this thing, so like even my students also. So I just thought to make this diagram just to clear this up, the concept. See, first of all, see, like this is our subclavian vein, right? Subclavian vein. Okay, and if we need to catheterize it off, for example, this is the rib, or the first rib, and this is the space, right? Like this is the space between scalenus anterior muscle and the sternocleidomastoid muscle. This space is known as spacium antisclenum, right? And we need to like, if I will say, for example, let me just make a which color should I use? Okay, let us use I just want a perfect color for this one. Okay, so let's just use like something like this. Okay, the purple one, maybe let it be, right? So we need to catheterize right here. Okay, so let me just make a catheter out here, right? Got it, guys? So that's why how we need to catheterize it off. And where is this located? In this space, that is what? Antrasclenum space, right? So this is the perfect thing which I can find out here. So we just need to catheterize it out directly right here, right, from this space. So that's why the answer is the spacium antisclenum, right? And now we have other spaces like the intersclenum, and like intersclenum is out here because it's between the two scalenus muscle. But again, like we know the perfect answer, right? Why should we even go towards those things? No, right? Patient with the myocardial infarction in the acute phase has been hospitalized into the cardiology unit to induce platelet lysis in the patient coronary vessels. So guys, indirectly just remember in this case, like in the myocardial infection, or when we are having the acute phase, so the most potent, right, platelet lysis, or the platelets inhibitor, like I would say, or just quote my point, right? So this is your streptokinase, right? During the early hours of infection, the following enzyme is what? That is your streptokinase, right? Again, guys, like the other enzymes can also be used, but this is the best answer. This is the drug of choice. That is it. Domestic accident has resulted in the significant blood loss in a patient, which was accompanied by the drop in blood pressure. With hormone ensure quick restoration of the blood pressure caused by the blood loss. That is your, again, the adrenaline and the vasopressin. Why it's only like why only this answer is present? See, adrenaline will contract the blood vessels, right? It will contract the blood vessels out here, And what is vasopressin do? It will, it will decrease the urination. So what will happen, if it will decrease the urination, it will increase the blood volume, and if the blood volume is increased, the blood pressure is also increased, right? So that's how we get the answer of adrenaline and the vasopressin itself. Aldosterone, no, it's a potassium sparing diuretics. We don't have any work of the potassium right here. Reproductive hormones, if the patient is having, like this accident, and we want the reproductive hormones, well, that's itself a very bad situation. Cortisol, no, we don't want any cortisol, because cortisol will just, progress the synthesis of adrenaline, but it's not perfectly adrenaline again. So oxytocin, again, oxytocin is just for the childbirth, and just those things, to the for the contraction of uterus, right? And for the lactation period. So we just don't want that thing right now for this question, right? Next question, we just discussed it yesterday. Vitamin B12 deficiency can cause which type of erythrocytes? That is what, megaloblastic. Right, it's the megalocytes, none other than the megalocytes. A 45-year-old woman presents with a breast cancer. Metastasis can spread into this case into the following lymph nodes. See, guys, like I just made the rough diagram of what the patient, what the question is saying. For example, this is the breast of a woman, and she's, let's say, just having the cancer out here, right? So where this cancer can spread, if it will spread the with the lymph node, right, with the lymph route. So either it can go in either in this way, or either it can go this way. So what is this? What are these lymph nodes? That is what, axillary. Axillary. What are these? This is the parasternal. Parasternal are what, guys? This is the behind the sternum, right? Behind the sternum, right? So that's why we have the answer as the axillary and the parasternal. And if you will even, just like say, okay, parasternal and the bronchomediastinal, well, it will, okay, so the bronchi or the something like that is draining out here. But like if we think about it itself, okay, the axillary lymph nodes and the breast structure is itself a superficial structure, right? It can be, considered as a deep structure. So no, this kind of answer. Cervical, parasternal, well, cervical, cervical or and parasternal, and see the cervical area is out here, for example. So will the lymph get that much up out here for just to spread out? Well, it must be spread locally, right? First of all, so this area can't be also the answer. Well, no. Again, aortic and the bronchomediastinal. Well, aortic lymph nodes are also located in the deep, and the bronchomediastinal also. This can't be the answer. Abdominal and cervical, again the same reason. It can't be the answer, right? The only and only logical, and the, this is even, I would say, like the little bit more common thing to think about, because see, these are these are located what? These are located locally out here, right? So this is even more easy to spread, right? Next question. 36-year-old man, okay, 36-year-old man previously diagnosed with the renal tuberculosis, right? Okay, what is the case of tuberculosis, guys? That is the, okay, just like type in the comment box, and it will just like just it will just give you a revision point. Okay, if you don't know, just see from the internet and just type it down. Okay, because it's an important point, right? And it is itself a acid fast bacteria. But the PARTS method detected no code factor. Okay, name the most reliable method of investigation that can confirm the or refute this provisional diagnosis. Well, that's simply the phase typing. This is again a direct question, right? But for me, if, for example, if I get this, if, okay, there are two things present. First is Mantox test, and other is the phase typing. Then like always give preference to the Mantox test, right? The second is always the phase typing. Next question. Okay, now I have just the, okay, the albumin content is very less. Albumin is produced by liver, first of the point. Second point, LDH5. Okay, we have, for example, 5 LDH. For the sake of the Krok, I will just write 4, that is 1 2 4 and 5, right? 1 and 2 is more in the what? In the heart. 4 and 5 is more in the liver, right? So the fifth is elevated, that is your liver out here, right? Next question. A patient with diabetes mellitus after injection lost his consciousness. Well, because he just had what like the hypoglycemia just occur. Hypoglycemia, right? And what is the guys normal concentration of glucose inside our blood? That is what 3.3 to 5.5 millimole per liter. Easy, right? Developed conversion. So the glucose level must be less, right? And how much less? It must be less than about less than 2.7, right? It must be less than 2.7 millimole per liter, right? So that's why he's having that much conversion. Result of biochemical test for the blood glucose level in this case. 10 millimole per liter, we are giving insulin to decrease the blood glucose, like not to increase. So this can't be the answer. 5.5, well, it's the normal. This can't be the answer. Again, increased can't also be the answer. 3.3, okay, it's down, but not that much down, so that it can cause the convulsions, right? 3.3, of course, right? Uh, okay, it's no, it's I would say it's less, okay, or it's the base value, right? It's the base value. So we just can't have that conversion on this point, so this can't also be the possible answer. So only, so see 2.5 millimole per liter, it's very very low, right? This can only be the possible answer out here. Next question, guys, that is what biopsy of skin sample obtained for one 24-year-old patient, caseous necrosis, right? So what bacteria I can suspect out here, that is what tuberculosis, right? Surrounded by the cellular infiltrate consisting of lymphocytes and the single giant cells or the macrophages. Proliferation of connective tissue and the endovascularities are absorbed. Characterize this pathological process. Well, it itself what a granuloma formation, right? Because see, this is what happened in the granuloma formation. These are the what giant cell is happening out here. The caseal necrosis are happening out here. So it will just no think about it in this. For example, there is a focus out here, right? And there is a formation of granuloma like this, just like a flower shaped, right? So this is something like this, right? Ischial inflammation, no, there is no ischemia like that. Simply catarrhal inflammation, no, it's simply written as the caseous necrosis out there, right? This can be a catarrhal inflammation. Intestinal inflammation, no. Abscess, there is no pus present out here, so that we can click this. So the only and only possible way is the proliferative glomerular inflammation out there, right? Next question. Again, guys, disturbed twilight vision, and we know which hormone is responsible for the vision. That is what vitamin A, right? That is retinol. If we think about the other like calcium, for example, it's vitamin D, pyridoxine, that's vitamin B6, riboflavin, that's vitamin B2, tocopherol, right? So these are not even like vitamin A. So we can just think about okay, twilight vision or the disturbed vision. So that's why like from the childhood itself, mom is saying okay, please do eat carrots because it's containing vitamin, right, which is essential for your eyes. So that's why, right? So take off. Okay, let's move to another question. What is jelly, guys? It's a direct question. There is no explanation for this. It's present where of the yolk sac of the umbilical cord, right? That is easy. Okay, I think right. Yeah. Sorry for that. I think I just lost this question. Sorry. Right. A 31-year-old woman who for a long time having the polyarthritis. Always remember, guys, what is polyarthritis? It is what? Inflammation of joints, right? Complain of elevated blood pressure, okay, change in adipose tissue distribution, and disturbed menstrual cycle. So it's the severe form, right? In the severe form, for example, in the initial stages of the polyarthritis, right, we can give what? We can give your NSAIDs, right? NSAIDs or just anti-inflammatory drugs. But for this stage, we must prescribe some kind of steroid, right, just to decrease down the inflammation, such as prednisolone. Easy, right? Because this type of drugs are directly from the NSAIDs, for example, endomethacin, right? NSAIDs, right? So we are just like not that much concerned, but we just know, okay, from the regime itself. What is that? For example, if somebody is having the arthritis and it's severe situation, right? So we must give some potent, I would say, the medicine, just to decrease the inflammation, right? Next question. Okay, pathologic material of the mucosal extraction from the nasal passages obtained from the patient provisionally diagnosed with the influenza was sent to the virological laboratory. What quick test allows detecting the specific viral antigen in this investigated material? That is easy, guys, because see, we need to suspect out the antigen, right? So we can just do it with the antigen antibody test simply, and the antigen must be what, having the radio, like the radio labeled, so that we can just see it out more clearly, right? Just to detect it out. And the method is direct and indirect immunofluorescence method, right? So this is already a direct question, I would say, right? And guys, for the last question, we see the last question is KCl concentration in a solution that surround an isolated cell was increased. How will the resting membrane potential and cell excitability change in this case, right? First of all, let's see what is the concept of the resting membrane potential, right? So it's an voltage gradient, okay, voltage gradient across the cell membrane, right? And it is simply affected by the ions inside and outside of the cell. For example, this is a cell, and this is what is happening according to the question, right? Right, this is what is happening. And what will see, the KCl concentration is just outside the cell, right? And what is going to happen now here? See, we from our knowledge of physiology, we know that the cell is having some channels, right? So it's having something known as the potassium leaky channels, right? Okay, and just think about it, guys. For example, if the concentration of the potassium is already a lot outside the cell, so the potassium will not be able to leave the cell, right? Potassium will not be able to leave the cell. So what is going to happen actually, and the sodium also, right? And the sodium will also not be able to leave the cell. Just think in that way. So what is going to happen actually? See, the intracellular charge, right? Intracellular of the charge of the cell is getting increase of positive charge, right? And due to this increase of positive charge, what is going to happen? So if there is even a less voltage, it can create action potential out here, right? So that's why the excitability is increased in this point also, right? Whereas the resting membrane potential is decreased, because see, now the gradient of the ions outside of the cell is increased very much as compared to inside of the cell. So that's why the resting membrane potential is decreased due to this explanation, right? Okay guys, bye bye, take care, see you in the next video.